Identify the necessary materials prior to starting the procedure. You will need a nasogastric tube. Here we use a Salem sump tube. Other required equipment includes McGill forceps, lubricant, and a laryngoscope with Macintosh blade. Also obtain an 8/0 endotracheal tube. After general anesthesia has been induced, place the patient's head in neutral position. Lubricate the nair through which you will insert the NG tube. Generously lubricate the nasogastric tube with Surgilube. Place the tip of the tube into the patient's nair. Gently advance the tube posteriorly, directing the tube toward the occiput. The tube will pass along the surface of the tongue into the posterior oropharynx. Use short jabbing motions to advance the nasogastric tube into the esophagus. If you are having difficulty advancing the nasogastric tube, try one of the following maneuvers. Displace the mandible anteriorly to open up the esophagus. As you lift the jaw, simultaneously advance the tube. Alternatively, grasp the larynx in the non-dominant hand and lift upward and anteriorly. Advance the tube into the esophagus. If you cannot advance the nasogastric tube into the esophagus with the previously mentioned maneuvers, an alternative method is to obtain an 8/0 standard endotracheal tube. Using stout scissors, cut down the length of the endotracheal tube. Using a laryngoscope blade, perform laryngoscopy as needed for intubation. As the epiglottis is lifted and the hypopharynx is visualized, identify the NG tube. Grasp the NG tube in the posterior pharynx with the McGill forceps. Gently pull the nasogastric tube out through the mouth while feeding the tube through the nares with the opposite hand. Gently place the longitudinally cut endotracheal tube into the mouth and insert it behind the already placed endotracheal tube, which is located in the trachea. As you push the second endotracheal tube forward, it will advance into the esophagus. Generously lubricate the cut endotracheal tube. Insert the NG tube tip into the endotracheal tube. Push the NG tube through the cut endotracheal tube until the tube will no longer easily advance. Remove the cut endotracheal tube by peeling it around the NG tube via the previously created slit. Gently pull the NG tube at the nair to straighten the tube such that it lies flat in the posterior oropharynx. To confirm NG tube placement, auscultate the stomach while simultaneously injecting 20 milliliters of air through the nasogastric tube. You should be able to hear a rush of air with the stethoscope. Alternatively, connect the tube to wall suction, watching for the aspiration of gastric contents. The nasogastric tube can remain on wall suction if needed for the surgical procedure, or can be placed to gravity after decompressing the stomach.